Maybe. Yeah, no problem. Yeah. Yes. Hi everyone, and welcome back to this channel. My guest, can you please mute yourself? Hello everyone, and welcome back to this live streaming today. My name is Nurse O. I'm so sorry for coming in lately. It was just due to some technical issues. I hope my apology today is going to be accepted. So, like I said, my name is Nurse O, and originally I'm from Nigeria, where I had my registered nursing and midwifery and my BNSC, and currently I'm in Canada now practicing as a RN. So today, while waiting for my guest, we'll just be, talking about how to explore being a registered nurse, especially mental health nurse in UK. So I'm just waiting for my guest to join. Hopefully, he's going to join us soon. So today we'll be discussing about how to become a mental health nurse. What are the requirements you need to become a mental health nurse in UK? What are the steps you need to take? Like, is there any sponsorship program in case you need to migrate from your country of origin, maybe from Nigeria, from Ghana? Is there any sponsorship program available? So those are the things we'll be talking about today. I'm still waiting for my guests to join. Hello, 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 everyone. Hello. I'm sorry, I'm having some technical issues today. And so that is why I'm coming in and going out again. I'm sincerely so sorry for that. So I'm just waiting for my guests to join all the way from United Kingdom. Sure, you guys are going to be so excited today. Hi, Narsola. Welcome to this live show. I'm so glad we eventually made it because I've been having so many technical issues. And I almost give up this live show today, especially being the first time I'm coming on YouTube channel. But at last, I'm so excited to be here. How are you doing?
Yeah, I'm all right. Definitely,
Good,
Sumatra.
good. I
How are
can
you?
even see from your face like you're looking so, you know.
Thank you very much.
So, without wasting much time, I'm just going to quickly introduce myself one more time before I hand over to you. Like I said before, my name is Nurse O, and for the purpose of those who are wondering what is the meaning of OO, so I'm just Nurse Oyin Loye by name, and I'm from Nigeria. I'm a registered nurse midwife with bachelor's of nursing in science and currently residing in Canada, practicing as a Canadian RN. So that is just a few information about myself. And today we'll just be discussing about how to become a mental health nurse in UK. What are the requirements in case you have been a general nurse before and you just want to have a change of specialty? Is it possible to move from possibly like pediatric nurse to mental health nurse. So those are basically what we'll be discussing today. So over to you, Nurse Ola. Just introduce yourself, and I'm going to be asking you some questions, which I'm very sure you will answer me very well.
All right, thank you very much. Thank you for inviting me to your channel. I'm happy to be here and try as much as possible not to bore our audience. My name is Olayinka. A registered mental health nurse in the UK. But before being that, I was a registered nurse in Nigeria, a registered psychiatric nurse, and a Bachelor of Nursing Science degree holder. Um, I think that's basically it for now. Uh,
Okay, that's very
okay.
interesting. So good to know. All right,
All right.
so I'm just going to ask you, like, who is the mental health nurse? Like, from back home, I used to hear psychiatric nurse, but recently now I'm hearing mental health nurse. Are they the same? Like, do you just want to tell us who a mental health nurse is?
All right. For the United Kingdom, a mental health nurse is someone who has been certified from the Nursing and by the Nursing and Midwifery Council of the UK
Mhm.
to practice as a mental health nurse. It's like being a psychiatric nurse in Nigeria. I don't think there is any major difference. It's just the name, if I can just put it that way. It's just
Okay.
what we target. But in Nigeria, we call them psychiatric and mental health nurse. But in the UK, they just make it a mental health nurse. Just,
Okay.
just how do you call it now? The just the name. I can
Okay.
see it. Just the name. Just the name.
Okay. Makes
So
sense.
yeah, that's it.
So you're telling me psychiatric nurse is just the same as mental health nurse, right?
Yeah,
Okay. Okay.
basically the
Thank you.
same.
So if I want to become a UK registered mental health nurse today, how do I go about that?
All right. For the United Kingdom, if you want to, there are different routes to being a mental health nurse. You can just go to a
Mhm.
nursing school here, a school of mental health nursing. They have mental health nursing as a course directly. So you just go there after you graduate, maybe 2, 3 years, then you become a mental health nurse. Another route to becoming a mental health nurse is there are some other programs that they do in the UK. Maybe you studied, you are not a mental health nurse in Nigeria or from any other country. You can still become a mental health nurse through master's degree route. So there are courses in which you become a master's degree holder in mental health nursing, even if you do not have nursing as a maybe at BSc level. So you can still become a registered mental health nurse
Mhm.
um, through master's degree. And just say, oh, I've been in the healthcare sector for a long time. I have experience in mental health nursing. Let's say, okay, I was a nurse in Nigeria or in Ghana or in Zimbabwe. And since I've been in the UK, I've been working for the past 5, 6 years in mental health nursing settings or in psychiatric settings, and I have experience. I can just apply for masters in mental health nursing, and within 2 years, you
Mm.
become licensed to become a registered mental health nurse. Another route, which everybody, like myself as well, became or got to become a mental health nurse, is through international, being an international nurse. You just write CBT um, in mental health nursing, then you do OSCE in mental health nursing, and you get your pin.
Oh,
Um,
that's good.
you
That
become a
sounds so
mental health
easy
nurse.
then.
Yeah, but it sounds so easy. If you before being doing that, before becoming a mental health nurse,
Mm-hmm.
um, you have to go through the normal route. You do verification, license verification from your country. The Nursing and Music Council of Nigeria had to verify my credentials. Then I was given authorization to sit for a CBT test.
Mm-hmm.
After pass, after having the pass grade, then you come to the UK to do the practical side, which is the OSCE. And you fulfill the normal requirement. Let's not forget, English language test is a general requirement. Like that band 7 is a must just for every other general nursing,
Mm-hmm.
every other general nursing program. So just do your your English test,
English.
do your
Okay.
verification, then write your CBT, come to the UK, do your husky, get your license, and start making your pounds. So easy.
So good to know. Just look at that. The way you
Yeah.
presented it so easily, like as if it's just something that is so cheap to get. I know it's not cheap anyways. So that's so good to
Well,
know. You mean if I'm in my
one
country, I
thing
can
that
actually write my CBT outside of UK, right?
100% anywhere in the world, just
But
register
it
with
also has to
SUG.
be within UK, right?
The OSCE have to be within the UK. There are designated centers in the
Mm,
UK that you can do your OSCE exam. You have Oxford. There is this one in Ireland. So
mhm.
there are centers like that here and there in the UK that you do your OSCE. They have designated centers. They have designated examiners,
Okay,
and
that really makes sense. So I think from all these
you can.
routes that you explained, the best one is to have like the general psychiatric training before from your country, right?
Yes,
That seems
that
more
is
easier.
that seems more easier. That's the
Okay.
easiest route. If you are
Okay.
licensed to practice as a psychiatric nurse or as a nurse from your country of birth or from your primary country, your nationality, then
Got you.
you just do your CBT and
That's
add
good.
the required English requirements.
Yeah.
Then,
And before we move to the next
yeah.
question, just a quick one based on the information you've just given. Is there any limit to the number of time one can attempt OSCE exam?
Um, well, normally it should be like 3 times, I think. Yeah, 3 times.
Mm,
But have I seen someone who exceeded that 3 times? No,
mm,
no, no, no. I've never seen any.
mm.
Just
That's good to know.
basic thing. Just it's not something so difficult to pass. As long as you've been practicing as a nurse, you get a trainer, an hospital trainer to train you for the exam,
Mhm.
then you're good to go. You will never do it more than 3 times. No.
Mm, that's
Yeah,
good.
you put your heart to it. If anybody tells you that, oh, it's scary, you may feel that person is just making
Mm.
you scared for no reason. You pass it.
Anyways, that's so good to know. So my next
Yeah.
question is just that, is it possible for somebody that doesn't have psychiatric training, possibly I'm a registered midwife or pediatric nurse from my country, is it possible for me to still write this CBT and OSCE in psychiatry and become a mental health nurse?
The answer is yes.
How?
Good. Um, you can write as long as you have, as long as you are a registered nurse,
Mhm,
you have certificates that prove that you have as long as you have a license and certificate to prove that you're a nurse, you can write CBT in mental health nursing. There is no yardstick that says that you can't write a CBT in mental health nursing. As long as if nursing council can give you and can verify you that you're on their register, nursing council will not stop you from doing CBT in mental health nursing. All you got to do, write it. If you're sure of yourself, then
Mm,
you become a registered mental health nurse. As long as you know you can pass your OSCE and you know what you have what it takes, then you're
mm,
good to go. You become a mental health nurse.
mm. I think that this one is a good one because, you know, even though some people from back home that are not psychiatric nurse, I think this will also be kind of maybe another area that they can look into because I know there are some countries that are so difficult for nurses to enter easily with, like Canada, except for recently that they've made some changes and they are trying to loosen these all these their policies that is favoring all those internationals. So I would just think this one would be a very good way for international nurses that are not even psych nurse that they can look into. Or what do you think I say? Like, am I making sense? Like for people that are not
You
oh,
have really making sense. What I encourage people is let me share a scenario.
mhm,
Um, I said something the other time that even if you don't have a degree in nursing, you can do a pre-qualification training in mental health nursing within 2 years and you become a mental health nurse. If you have that experience, like I said, experience is the most basic thing here.
mm,
If you have that a basic experience in mental health nursing, there are so many nurses here, even in the UK, who are not mental health nurses, but they've been working in the mental health facility for a very long time, and they are doing fine in mental health nursing, even as general nurses. So if you have the experience,
mhm,
if you have, like I said, I'm quoting that word experience. If you have that experience in mental health facilities in Nigeria and
mhm.
you have confidence in yourself that
Write
you
the
have
exam.
passion for it, you have the basic 6 C's in
Mhm.
nursing that the NMC require of you, then you can do it.
That's good.
So easy.
That's
So
very good. That's very
become a
good to
mental
know.
health nurse.
That's very
And
good to know.
trust me, I encourage people to go into mental health nursing
Oh
because
yeah.
if they are not a mental health nurse in the UK,
I think
nurse.
I'm getting motivated to come to UK now to come and start practicing as a mental health nurse because
Yes,
I heard you
so
guys are making cool cash. And that will lead me to my next question, right?
okay,
So,
okay,
my next
okay.
question is going to be, do you think registered psych nurses make more money to other nurses like operating room nurses, um, accident and
Well,
emergency nurses? Don't tell me lie,
yeah,
you know,
yeah. I will tell you the basic truth. The truth
for
is,
sure.
the answer is no. We don't
Hmm.
make more money than other nurses.
Are you for real?
No, we make the pay is the pay is the same. Well, what determines the pay of an individual? Um, I can't say one thing that will basically say that, oh, you earn more than me. There are some factors that you put into place. Where you're working will determine how much you earn. One, two, experience sometimes, not all the time, will determine how
Okay.
much you earn. Three, your location. You don't expect somebody who resides in London and somebody who resides in say Stoke-on-Trent, their income will definitely be different.
Hmm.
So someone in London will earn more than the person in Stoke-on-Trent. Why? Because of the cost of living in those environments.
Hmm.
So it's not really the profession that determines the pay or your specialty, luck, your employer, and one thing people don't know. For somebody who works in the private sector and somebody who works in the government sector, definitely you know the person who works in the private will earn more than
For sure.
person who works in the government. Unlike in Nigeria, anyway. In Nigeria, when you are working in the government, you earn more money. But here, when you work in the private sector, you earn definitely more than those who work in the government
Mm,
sector. NHS will not pay you as much as private sector will pay you. So um, that also can determine what you earn. And also, if you are still working with a COS, say you've been in the UK in less than 5 years, you are not going to earn as much as somebody who has indefinitely to remain or a citizen in the
mhm,
UK. Another thing that can determine your pay is um, okay, well, I have said it, but let me just emphasize more or clarify. If you are doing agency,
mm,
definitely you earn more than somebody who is doing permanent role. And if I
okay.
tell you that psychiatric nurses earn more than general nurses, I will say the only reason why I will tell you that we earn more is because when you compare the workload
Mhm,
that general nurses put in and the workload of psychiatric nurses.
mm,
Doing this, in physics, we will talk about the inputs, not inputs now. I want to really remember the word to use. Um, the when your effort,
mhm,
the load, when the load is more than the effort,
mm,
you know what happened to the result. But the load, the effort you put in mental health nursing, in mental health nursing, and those in general nursing. Imagine when you're a general nurse, you just keep going and put your hands in blood, you do lots
mhm,
of procedures.
mhm.
But in mental health nursing, what you need is this. You work more with this, with your
Yeah,
senses.
their
So if
brain. Oh
you
yeah.
can do that and you just make your money working with your senses, unlike somebody that's running up and down and stuff.
Mhm,
Come on. So then I can say that psychiatric nurses or mental health nurses earn more. Also, it's easier for mental health nurses to do more shifts compared to general nurses. The general side will work you and then they will stress you. You you do value for that money.
mm,
Like they will if you for every pound they pay you,
mm. You will sweat for it.
you sweat for it. You sweat for
So
it. So
averagely, how much can you just estimate for a person that just got his or her license to become a psych nurse? Like how much averagely per hour can you say a psych nurse make in UK?
okay. Per hour or per annum?
I would say per hour, like for a new
Per
psych nurse.
hour.
Yeah, for a new psych nurse that
Okay.
just get into the
Like I
system.
said, I'll just put it in an average. Let's
Mm.
say between the rate of £14 to £22.
Hmm.
Average between £14 to like let's say 23 anyway. Between average of 14 to 23
I
pounds
think I'll have to
for a
consider
cycle.
that one very well before I pack my things and come to UK to become a psych nurse because that
You are
14,
making you make more money in
that
Canada
14 is not
too.
encouraging at all. I wouldn't want
Well,
to come.
that is UK for you.
Hmm.
NHS is not so encouraging. It's not so
Okay.
encouraging. But
Yeah.
with when you do night shift, you do weekend
Mhm.
shift, you do Sunday shift, all those things determines your income as well.
So there's going to
So
be like
like
shift premium, right?
exactly.
Mm.
So it's not that's why I said you can't really say that, oh, this is the basic pay. What I
Mm.
earn this month will definitely be different from what I earn next month. Will
Mhm.
definitely be different from what I earned the previous month. So
Yeah.
it depends on the shift, what type of shift you're doing. A permanent night worker will
Yeah.
earn more than somebody
Yeah.
who has been doing Monday to Friday, 9 to 6.
Mhm.
Definitely. So those are the things that influence the pay.
I got you. Thank you so much for that. And my next question is going to be: are there area of specialty in mental health nursing? Like, in nursing we have like OR. Even if I'm a general nurse, I can choose to work in accident and emergency department. For psych
Yeah.
nurses too, do you have area of specialty that you guys work in?
Well, in mental health nursing, there are areas that you work in. You may
Mm-hmm.
not really specialize in one, but you have your unit you work on. As
Mm-hmm.
I work in the acute setting,
Mm.
but that
So what do
doesn't
you do
stop
in
me
acute
from
setting?
working in. It's just like normal acute care. The best way to explain is let me use Nigeria as an example. You see people who are sick, who go to the hospital, who have malaria, you go there, they treat you, you feel better, then you go back home.
Mm-hmm.
You may be admitted for like 1 day, 2 days, 5 days.
Mm-hmm.
So acute care is just like normal acute um
KP.
glomerulonephritis, acute, normal acute. It doesn't change a
Okay.
thing.
Okay.
So, but PQ, there is PQ as well. That is psychiatric intensive care unit. It's just like the normal intensive care unit too.
Mm-hmm.
But in this case, it is psychiatry. In normal intensive care units, you see patients being on oxygen, but in this case,
Ventilator.
for
Yeah.
somebody who is in PQ, the mental illness is very severe. It's at a very severe stage. That person is very ill at that point in time. So that is in PQ. So
Mm.
PQ is if you see people work in PQ, I think they are the real psychiatric person
Okay, because
because
I used to hear
you have
some
to
would
be very,
say
very
drug and addicts units,
yeah. So you can
forensic stuffs like that. So I'm just wondering
forensic,
whether
yeah.
they're all the same.
Forensic is yeah, they are not they are just like I said, it's just mental health nursing. But the
Mm,
unit you work in will determine um your scope of practice, if I
mm,
can put it that way. When I first came into the UK, I worked in the secure setting. Secure settings is like let's say a place where you see people section 37, 40. Okay, let me bring it down. People who have criminal cases, if I can just put it that way.
mm,
Maybe they have criminal cases. They instead of being to the prison, they believe out. Maybe somebody who did an arson, or maybe shoplifter, or maybe attacked somebody or
mhm,
assaulted someone, and the police feel or the court feels that the person will be better served in the hospital
mm.
than in the cell or in the prison. So those are the people they send into active settings. I mean, in secure settings.
Okay.
So there are those ones in Nigeria we can say forensic. You understand? So those are um those are the secure settings. So we can be in low secure, medium secure, then the high secure and stuff. So that is another aspect. Also, we have step down and rehabilitation. For
Mm,
somebody who has been in the acute setting, say, oh, you've been there for some months and they believe you will not do well at home, they can just step that person down in a rehab unit just for mental health rehabilitation.
mhm.
And there are some that they will want to manage in the community. So those are community mental health nurses.
Yeah.
So some works basically in the community. So you can see those
Oh yeah.
special areas in psychiatry.
Yeah.
Yeah.
Yeah. Yeah.
So we've
So are
mentioned
you the one
secure
that
settings,
determines the unit
acute.
where you intend to work, or your employer?
Um, I can say both, but it basically depends on your employer
Mm,
and your experience too.
Okay.
but it's majorly depends on your employer.
Okay. Okay.
It majorly
That
depends
answers
on
my
your employer.
question.
Yeah. If you feel that, oh, let's say, take for instance, you got an employer
Mm-hmm.
who maybe you got a job in a secure setting and you feel like, ah, no, this secure setting is not my thing. I just said, I'm tired of secure settings. I'm going to acute settings. And if you think, okay, I'm going to PQ, and when you get to PQ and you see the fast pace and you want to observe somebody every 5 minutes, and you do one-to-one observation, you do enhanced observation, you three people, three staff have to be on one patient, and be like, no, I think I'm losing my sanity. You
Mm.
can look for an employer and go to rehabilitation unit. And when you get to rehab unit, you may be like, oh, this rehab is too boring.
Mm.
The first time I worked in a rehab unit, I was like, no, I'm not coming tomorrow. It's too boring. So you may be like, I'm tired of rehab units. So
Mm.
you just leave and go to community. So
Okay, thank you so much. I'm almost through with my question. I think I have just like two more questions to quickly ask you. So, is it possible for me to hold two licenses? Like, is it possible to be a psych nurse and at the same time be something like maybe a registered midwife in UK at the same time? And can I
yes,
practice both simultaneously?
yes.
How?
The answer is yes. Okay. You can be in back home. We are dual qualified. So here you can be dual qualified as well.
Mm,
You can be a mental health nurse and at the same time be a general nurse.
mm,
So being a general nurses there, they call them RGN, registered general nurses. Those are the ones that did CBT in adult nursing. So they call
okay.
them adult nurse. Yeah. So you can have certificate in adult nursing or do CBT in adult nursing. When you pass, then you do like, oh, I've been working in the psychiatric setting. I think I need to have a license as a mental health nurse. Then you write your CBT again, do
Okay.
your OSCE again, and have license to practice as a mental health nurse too.
Mm,
So you can have license to practice as a registered general nurse, and you
yeah,
can have license to practice as a registered mental health nurse. You can have both licenses at the same time.
that sounds so
And
good.
I also I think there is another school now. I think I found one that you can even that they will even train you to become two, both adult nurse and mental health nurse.
Mm,
Yeah.
that's good.
So
That's good.
it's possible. You
That's
can be
good.
a nurse, you can be a midwife at the same time. You can be
It's like nurse.
an adult nurse, and you can
Yeah.
be a mental health nurse at the same time.
Oh. So all I just need to do is just to keep writing the CBT and
Just
OSCE in
keep
that area that I
yeah,
intend to be.
exactly,
Oh,
exactly.
makes sense.
And you can I've seen people who are adult nurses that works in the psychiatric setting as well.
Mm,
So they don't have certificates or they don't have license to practice as a mental health nurse. But
mm-hmm.
because of their experience in the mental health nursing setting and they have license to practice or to take care of an adult, they
Okay.
find themselves in the mental health setting and they practice and there's no
Okay.
problem.
That makes sense. And that leads us to the last question because I know you're a busy guy. You want to jump into the town. So I'm not going to waste much of your time. So the last
Okay.
question is going to be on immigration. Just a quick one. Like, do you think it's easy for psych nurses to get sponsorship to other category of nurses? Because I remember there was a time I have like two or three friends and two of them, they've already passed their CBT, but they were not psych nurses. And so they were looking for sponsorship, they were not, which they were not able to find that time. But among those three friends, one of them was a psych nurse, he just quickly got an employer straight away. So then I was wondering maybe there is any preferential treatment they give to psych nurses compared to other foreign nurses. So I'm just wondering, maybe you can shed more light
Uh,
whether psych nurses get more
well,
sponsorship
from
than other categories.
from my little experience, exposure, and
Mm-hmm.
not this research is not proven yet, but from what I've gathered, if you are a psychiatric nurse, if you do mental CBT,
Mm-hmm.
the chances of you getting a job with a very good CV within 1 week, quoting, within 1 week,
Mm.
very high. The chances of you getting a job as an adult nurse within 6 months.
You, I can see that you're not even speaking louder. You don't want to loud it. Like,
So trust me, if you want, permit me to use the word fast
mm-hmm.
to mental health nurse.
Mm.
Be a mental health nurse. That is your quickest,
Way.
fastest, easiest route
Mm.
to getting a CS.
Mm.
There are employers with you.
Mm-hmm.
Drop your CV, your well structured CV with your experience. You won't, uh, within 3 months,
Mm.
you are here.
Mm.
But if I should share my own experience, at least I think I did my CVT. Um, let me calculate the what it takes me when I did my CVT to when I got to the UK. So 29 August, September, October. It took me less than 3 months.
Wow.
In fact, 3 months, take 10 days from 3 months, 11, 12. 12 days minus 3 months, let's say like 70 something days, 78 days
Wow.
to get to the UK.
Wow.
So, and you know, that process includes um, immigration process, getting appointment in the higher, the visa screening and stuff. So those are the things that delay. If it were to be, I did my CVT the following week, I got a job. In fact, the day I put my CV on the internet, I got three
Wow.
calls that day. Three.
Wow.
The
Wow.
same day I put my CV on the internet, I got
Mm.
3 calls that same day.
Mm.
So it now boils down to like which one should I go for?
Mm.
So
That's so good
then
to know.
if
So now you're
if
encouraging
I should
us to
exactly
go
so
back to
it
school.
may be luck, but if that luck is for me and for almost
Mm.
all the people I know,
Oh,
then
yeah.
I think it may not just be luck again. It
Yeah.
may be
Yeah.
substantive because
That
I have
sounds so
so many
interesting
people
to know, anyways. So interesting
so
to know. I really learned a lot, honestly, from all these discussion we had today. So, summarily, all we are saying is that if you intend to practice in UK as a psych nurse, you already had all the requirements you need. All you just need to do is basically two things, if I'm not wrong, just for you to write your CBT in your country and move to UK where you'll be allowed to write your all skill exam, you pass and you get your PIN, right?
right.
That's the
Yes.
easiest
And
way, anyways.
let me also say this. That is the easiest route. And
Mhm.
for this is an unpaid advert. If you are not a nurse
Mhm.
and you want to practice as a nurse in the UK, if you've been working in the hospital setting for a long time, and you have a degree in health-related program.
Hmm.
All you need to do is to apply for a pre-qualified course, master's in nursing,
Thank you so much,
and
people, for
within two
joining
years,
in. I can see you all. Nosalabi, Mommy Mo,
and
Titilola.
within
I
two
can
years,
see all of you. Thank you so much for tuning in. Really appreciate.
yeah,
I'm sorry to cut you short.
okay. So within 2 years, you become a mental health nurse in the UK.
Hmm. That's so good to know. Thank you. Thank you. Thank you so much for that. So I really want to
Welcome.
appreciate you so much today for giving me this audience and for showing up today on my channel. Thank you so much and God bless you. And I also want
You're
to
welcome.
thank everyone that were able to join this live show. I sincerely appreciate your time. Don't forget to like this video, share with your friends how they can become a registered psychiatric nurse in UK. And of course, like I used to say, please don't forget to subscribe to this YouTube channel. You know, it's just a growing one. I just started and it's really growing, growing, and growing so fast. So I thank you so much for you tuning in every time to come back to this channel to watch and rewatch. So until the next time when I will be seeing you again, I would just say every one of you should remain safe. Try to be safe out there. And of course, you know, Nurse O cares about you so much. So please stay safe. Nurse Inka, thank you so much again. My
You're
regards
welcome.
to your family and hope to see you next time on my YouTube channel, right?
No worries, no problem.
For sure.
Thank you very much.
You're
Bye bye.
welcome. Bye.